Welcome back to the Recovery Channel. I'm your host, Brian Ariel, Treatment Director of Recovery Outpatient Services at Applied Care Services. Today, we're going to talk a little bit about correcting misconceptions about addiction. But first, let's talk about heart disease. Let's talk about asthma, and let's talk about diabetes. We'll get to the addiction a little bit later. When we think about heart disease, when we think about diabetes and asthma, we can think about genetics, and we think about lifestyle, how we live our life, the choices we make within our life, and those all can lead us into acquiring heart disease, diabetes, or asthma, or even COPD if we smoke a lot, right? So with those things, we have the genetic, we can agree on that. We can agree on lifestyle choices, and we can agree on some of the other things that are there, right? So let me take you through something. If someone had a heart attack, would you say you were just weak-willed and you had character flaws, and guess what? You got what you deserved. You had a heart attack. All you had to do is choose not to do those things and you wouldn't have had a heart attack. We can say the same thing about diabetes. We can say the same thing about COPD. But would we? Would you shame someone for having a heart attack? Would you shame someone because they had to use insulin to control their blood sugar? Would you ridicule someone if they had to use a rescue inhaler or take medicine for COPD? Now you might say, that's crazy. You'd be right. That is crazy. Let's put addiction in there. Addiction is an acquired disease, much like heart disease, much like asthma and diabetes. Genetics, lifestyle choices, and other things, very complex things, all play into it. But yet we feel it's okay to ridicule those that struggle with addiction. We might say, well, they have to reach rock bottom before they'll change. Well, let's ask that of someone who's had a heart attack. You know, it's finally glad that you reached rock bottom. You had your heart attack and now you'll change because it took this to make you to change. Sometimes it's true, sometimes it's not. But we wouldn't say that to someone with heart disease, with asthma, or with diabetes, now would we? But yet, we'll shame someone, ridicule them for their acquired disease of addiction. I think we need to change our thinking on that, right? We shouldn't shame people because they have a disease. We need to look at addiction not only as a disease, but with the same mindset as we would look at heart disease, diabetes, or asthma. It's an acquired thing over time. You don't think one day if you eat wrong that you're going to get heart disease, or you're going to have diabetes, or you're going to get COPD, because that's far off. It never enters your mind about the consequences of your lifestyle choices. The same is with addiction. It never enters the mind to say that this could harm me. I could be addicted. I could lose everything. I could possibly die. So to use these misconceptions that you're weak-willed, that you have moral failures, that you have a character flaw or something like that, it just doesn't apply. Another thing, you got to hit rock bottom before you'll change. Well, everybody's got a different rock bottom. You might take a DWI, it might take going to prison, it might take your divorce, losing your job, all those other things before you realize. Or it might take the ultimate rock bottom, which is death. Death, that'll definitely change you. You'll stop using. That's not the solution we're looking for. And some would say, punishment. We got to punish you for what you've done. Lock them up and throw away the key and shame them and ridicule them. Well, okay, let's apply that to heart disease, diabetes, and asthma. So maybe we should punish those people too and throw them in prison too, because they have an acquired disease. The social stigma around addiction is what keeps people addicted. The shame, the guilt that they feel, and the ridicule that they receive from family members, from community members, and from those around them is what perpetuates this, along with the acquired disease in the brain. So we need to stand up and we need to give compassion and love and grace to those that are struggling with addiction. Give them a hug. Tell them you love them. Do something for them to improve their life. Get outside of yourself and actually step in the gap and help someone. Don't drive by them and ridicule them and have your little thoughts about them. Because remember, if we treated other diseases like we treat addiction, everybody would die. Brian Ariel with For the Recovery Channel through Applied Care Services. Be mindful and show compassion.